just by the physiology of it, if you take opioid medications chronically, you're going to be at risk for addiction. There's no question about it at some point. Once somebody's on these pain medications, I think it's very important that the medications are being used for the right reason, to achieve pain control, and only what's necessary. And I think usually there are other strategies that could be employed. So non-opioids that are medications that can be very helpful. Even something as simple as aspirin or acetaminophen are quite effective if they can be used. Anticonvulsants or antidepressants can also be used as adjuncts. And somatic therapies, physical sort of therapy, stimulators, injections, lidocaine patches, etc. So there are many other strategies that should be employed where possible. And the duration of the prescription should be limited with very close follow-up and monitoring. And nowadays, physicians are required to take additional courses on how to prescribe opioids safely, and employing what's called the Prescription Monitoring Program, which is a statewide database to monitor what patients are filling at the pharmacies. So the doctors can check if this patient is filling multiple prescriptions for pain medications from multiple doctors. In real time, we can identify a patient who is what we call doctor shopping or hospital shopping, and we can identify that right away. And the database is very easy to access, and I use it every single day. So classically, with any kind of addiction, we look for a couple things. Number one is the person is using more than they had intended to use. So they only want to take 1 or 2 Percocets, but they always end up taking a few more extras. Another is persistent or failed attempts at cutting back. So you're noticing that you're taking too much, you try to take less, or you try to stop it altogether, but you're not able to do so. Another is when you continue using that particular substance, even though you know it's now harming you, both psychologically or physically. Another is that you're spending a lot of time obtaining and using and recovering from the substance. And then finally, if you begin to give up other activities for the drug use, so you stop seeing your friends, or you miss work, or your life is now being interrupted due to the drug use. People with addiction are often very ambivalent. They feel both ways about it. They recognize the problems, they want to stop, but at the same time, the drug use is so attractive and it draws them to it, So they're always split and they're very ambivalent. And they can really fluctuate significantly from day to day, hour to hour, And usually we try to catch people when there are these moments where they're more interested in treatment. Those are very important opportunities. And for example, hospitalized patients tend to be in that moment. They're sick, they're hospitalized, they're thinking about their health, so they're typically more interested in treatment. And so I feel it's very important to engage patients in those moments because this is a potentially lethal illness. And every opportunity we have, we should be trying to engage those folks in treatment.